meantime, we know that kids are headed back to school. The pads are on. Some kids are already going through two-a-days. God help them on Thursday when we have 95-degree heat. But there's a real question about how you prepare your kids for fall sports.
And not just fall sports, but just, out playing with their friends during this time of year, because kids are out and they're going to be playing as school gets underway. And school is getting underway, and thousands of children are injured every year on playgrounds while playing sports, or as they walk or bike or skateboard or nowadays scooter back and forth from home to school. I spoke with Henry Ford Health pediatric orthopedic surgeon, Dr. Christopher Minnock, and he says there are a few things we can do as parents to make playing with friends and playing sports a little bit safer for kids.
I think there's some common sense stuff we can do, including helmets on bikes and on scooters and things where you can have a big fall and impact the head. If kids are doing skateboarding, rollerblades, that kind of stuff, using some basic knee pads and wrist guards will help prevent or limit how bad injuries are if they do take a big fall. In general, I tell people just use common sense. When you're playing, if something doesn't seem like a good idea, maybe think twice about it. Certainly around trampolines, we see some issues that we can modify for patients where, limiting jumping to one person at a time is helpful at decreasing the risk of injuring somebody else in the air or double bouncing somebody and having them go really high. There's a few things I can think we can do to make things a little bit safer, but in general, we try to keep kids active, playing, running, jumping, and just trying to keep them as active as we can.
Dr. Minnock says there are times when a sports injury may be minor and parents can treat the child at home.
And so if you have an injury, let's say you twist your ankle hypothetically, first thing we would do is to limit some of the inflammation. It's going to ramp up over the first 1 to 2 days. And ways we can do that, we use the acronym RICE, which is to rest that area, to ice it, to compress it sometimes with an A-strap you'd wrap around or a tighter fitting compression type sleeve. And then elevate it. And all that will help limit that inflammation while you get through that early phase as your body's going through that inflammation and the healing process. If that's something where the injury is still pretty swollen and bruised and kids aren't wanting to walk on something or really use it in a hand or an upper extremity, that may be more concerning for a fracture depending on the injury. And that's something we may want to see in our clinic to check.
If a child has a fracture or a broken bone, many times they have to wear that plaster cast, which can be bulky and itchy and non-adjustable. It can also have a moldy smell, but there are now waterproof casts that are more durable and less itchy.
The outside looks the same as a traditional cast with that protective fiberglass that's colorful, but underneath it's more of a mesh or a synthetic cotton that'll dry out. So you can get it fully wet in a shower, a bath, pool, or lake, and it'll still give that same protection while the fracture's healing. We've done a lot of those this summer. They've been pretty popular.
Dr. Minnock says kids who play sports with fractures of the upper extremities like forearm or wrist can most times return to sports like soccer or even football while wearing the waterproof cast. Sometimes, he says, teams will have you wrap that cast in bubble wrap so you don't use it against another player, but he says it still will be protected and safe enough to play while that fracture heals.